an NHS order that spending be increased. The research organisation The King's Fund says 40% of mental health trusts had their budgets cut last year, and that 6 trusts out of 58 have had their funding cut for 3 years in a row. One of those is the Norfolk and Suffolk Foundation Trust, who've admitted responsibility for the death of a schizophrenic patient. Neil Jewell died 3 years ago. Our health correspondent, Sophie Hutchinson, has been speaking to his family.
He was, I suppose, his most happy and relaxed when he was up, with a family. That's he just wanted to be part of the family, really, and it's very sad to think that this awful illness that he had took that happiness away from him.
Christine's brother Neil Jewell struggled with schizophrenia, but he died after what his family say was a catalogue of failings in the local mental health services, both in the community and in hospital.
It was a complete nightmare what happened to him. It should never have happened. And then you start getting angry. And you think, well, these are people's lives. I mean, my brother was just left to cope on his own. And the whole point of this, going through this pain, is to make sure Neil's voice is heard through this, and for people to understand that mental health issues don't just affect people like my brother. Anybody in society, no matter who you are, can suffer with, at various times in their life with mental health issues.
Mental health workers failed to ensure Neil Jewell had enough medication. They failed to find him a safe hospital bed. He ended up being restrained by police, driven 75 miles while psychotic, before he had a heart attack and died. Cuts don't always coincide with poor treatment like that suffered by Neil Jewell, but the Norfolk and Suffolk Mental Health Trust, which treated him, is one of a handful to have its budgets cut for 3 years in a row. And a leading research organisation says last year 40% of mental health trusts in England had their budgets cut again.
Cutting mental health services is just as risky as cutting our acute hospital services. We're talking here about people in crisis who need expert care in a timely way, and often that is not being provided at the moment. That's bad for patients and their families. It's also a risk to communities when you've got people who are severely ill who aren't able to access the right care.
But last year, for the first time, NHS commissioners in England were instructed to increase money for mental health. NHS England says overall spending did go up. So why did so many mental health trusts, who provide the bulk of the care, see their funding cut?
There's real pressure on acute trusts, that's the big hospitals, but there's real pressure on mental health. So commissioners are working hard to make sure that they deliver mental health care for their populations. There are some tough choices to make, but we are committed to making sure that people with mental health are treated as well as anybody else in this population.
Yeah, do you remember when we used to bring Neil over here for walks?
The trust in charge of Neil Jewell's care in Norfolk and Suffolk has expressed its deepest sympathy to his family. Inspectors have said it should no longer be classified as a failing trust, despite ongoing concerns about high rates of deaths there.
No, he loved his dogs.
Yeah.
You can't mess about with people's lives, people that haven't got the ability to stand up and speak for themselves. This is people's lives, and how quickly they can be snuffed out, just like that.
Christine, welfare there ending.